Happy Thursday, everybody, and Happy New Year, belated New Year as well. Normally, I focus most of these talks strictly on bariatrics, weight loss, and things, but sometimes I like to kind of reiterate and solidify process issues or update you on changes and how things are done, and sometimes explain why things are done. It's very confusing sometimes to say, why did they suddenly start doing things totally different than they used to? Well, in the recent legislative session, and this is talk, if you're not interested in pain management and how we manage post-op pain, you can skip this one and it's okay. But if you wonder why we do things a certain way we do things, a lot of it came in effect after the legislature met last year and started in September. They passed several laws, and one of them created something called the Prescription Monitoring Program by the state of Texas. And it had certain requirements that affect us directly. Obviously, when you have surgery, you have pain and you need pain medicine. And the new law now requires us that it can only be prescribed electronically. We don't carry around those fancy prescription pads anymore. We're not able to leave a prescription pad at the hospital or in our car or wherever. Any post-op pain medicines that are considered an opiate, which is what we usually use, like a derivative of either codeine or hydrocodone or something like that, has to be prescribed electronically. We're not allowed to refill that prescription without reevaluating the patient. We can't, quote unquote, call it in. We can't write you a prescription. We can't do it unless we are physically in the office on our computer with a state-issued little gadget that gives us a certain code that allows us to transmit that prescription. I realize that this is inconvenient and frustrating for a lot of patients because surgery hurts. And some of us need more than that 1 week or 10 days worth of pain medicine. But at this point, with the current laws, our hands are tied. When I decide that you're going to have surgery and we're prescribing your pain medicine, I have to go into this program called the PMP program. It tells us and it tracks every prescription a patient has had filled for a significant period of time. If you have had a prescription filled for a significant amount of pain medicine, like Lortab or Vicodin or hydrocodone, it will not even allow me to prescribe any more of that medication. Now, this is for the public's protection. It's to prevent people from using medications that were intended for someone else. It's intended to prevent people from using too much of a good medicine. It's to prevent people from getting addicted, which is a big problem. So don't be frustrated with us if we say, if you need a refill on your pain medication, you have to come into the office. That's not my decision. That's not our nursing staff's decision. That is what we're required to do to be in compliance with current regulations. Thanks for tuning in. I'll see you soon.